From a South West LHIN perspective, we know that we need to think through other strategies that will help to support leadership, both at an executive level within organizations, but also from a governance perspective. So working with our boards across healthcare organizations so that quality is a priority for all health service providers.
Advancing quality in long-term care homes was the focus of a day-long forum attended by more than 160 people, representing 77 long-term care homes from across the South West LHIN.
Today was an opportunity to bring the long-term care homes together across our LHIN to really focus on quality improvement and how it's impacting the long-term care home sector. When we look at healthcare across our LHIN, we know that we want to be client-centered or resident-centered and look at how we can improve outcomes for those that we serve. And so quality improvement is a great strategy. Within the long-term care home sector, there's a particular initiative right now through Residents First and Health Quality Ontario focused on the long-term care home sector. So today was a great opportunity to hear more about how Residents First is advancing in the South West LHIN and engage our long-term care homes, as well as some other key initiatives that will impact them over the next number of months.
What we're trying to accomplish is supporting long-term care homes by providing environments for residents that enhance their quality of life. So really, when you're looking at the work and looking at the involvement and creating the plans, it really is about the resident. So it's intended for anything that you can do that helps with your planning, helps get your frontline staff back to where they want to be, mostly. So getting time spent right back to the resident, that's really what Residents First is all about.
The morning session, led by Deborah Woods and Linda Hebel of Health Quality Ontario, focused on quality improvement. The pair offered 2 simple quality improvement tools to help senior staff at long-term care homes engage and empower their team.
The sample tools. On your left, you see the fishbone. Over to the right at the top is the 5 whys. These 2 are on your table, and that's what we're going to do.
We had the homes try on 2 quality improvement techniques or tools, the fishbone and the 5 whys, which is a really simple and useful way to help leadership and managers in homes engage frontline staff in identifying the problems and getting down to the root of the problem, because often we sit around the table and we think we know why something's happening, and then we immediately jump to a solution. And when we go to implement that solution, what we find is, you know what, we didn't really fully understand the problem. So through using the fishbone as a quality improvement technique and the 5 whys process and method, it's a way to help at home focus first on really spending a bit more time in that problem identification before jumping immediately to a solution without really fully understanding the problem.
Woods wanted participants to take away a greater understanding of how to use quality improvement tools in their long-term care homes.
What I'm hoping that they're taking away is the importance of quality improvement in their homes, and what we have here are, I would say, the innovators of the Southwest and the long-term care homes, the administrators that get it, that are living quality, and that are interested in continued support for how to do that. And most of the homes today are involved in our Leading Quality curriculum, which is a way for homes to really track and document their quality improvement through quality improvement plans that can be used to help them align a lot of their efforts to meet a lot of the needs with reporting requirements, with the Long-Term Care Act legislation, with compliance accreditation. So what I hope the homes have heard today is that through engaging quality improvement and participating fully in the Residents First initiative, although it is time up front to understand and take advantage of the training opportunities, that it can help align their work to meet multiple priorities at one time, so minimize the duplication of their work.
We need to continue to ensure that residents in the long-term care homes are protected and cared for, and their dignity and rights are respected. Certainly, the Ombudsman has made it very clear to us that we need to be able to assure the public that our first priority is also the same as yours, the care and safety of the residents. And we really did need to build a new inspection process that was built on how are we making sure that it's evidence-based and resident-centered as we move forward.
The afternoon featured several topics, including a presentation from the Ministry of Health and Long-Term Care Performance Improvement and Compliance Branch about the Long-Term Care Home Quality Inspection Program.
And families like being interviewed and appreciate being part of the process. A team of 3 to 4 inspectors on a small home with only 1 nursing station and 1 computer is absolutely overwhelming, and we've heard that feedback loud and clear. We've actually done a few inspections with just 2 inspectors for smaller homes, and it has worked very well. Some homes found it a bit overwhelming initially, but once things got rolling, felt that it was a very comprehensive process built in quality improvement principles, and could see that it added value to what was going on within their own particular facility.
There was also information from the South West LHIN about access to care and the behavioral support program, as well as the South West CCAC regarding applications and reassessments and crisis placements. The day finished with information about the formation of a South West LHIN long-term care home network.
So it was a natural evolution to get together, and when the LHINs were forming back then, because this took place in about 2008 or so, we saw this as an opportunity to be more relevant in the LHIN than what we were before.
The long-term care home network that's under discussion is really about bringing the long-term care homes together on a more regular basis as a system within the South West LHIN. So an opportunity to look at relationships with the LHIN, with the Community Care Access Center, with other networks that benefit long-term care homes, and as well just a means to really build on the leadership and the issues that long-term care homes experience across the Southwest. We know that with the 77 long-term care homes in the Southwest, they have unique circumstances. They're spread across a large geography. Some are more urban, some are rural, some are small, some are large, some are independent, some are part of larger corporations, some are attached to municipalities. So there's a myriad of issues that impact the different homes differently depending on their context. So it's important to have participation and representation from the various homes across their LHIN to really understand what their issues are, how the homes are impacted by changing policy or legislation, how quality improvement happens within those homes. And so because of that uniqueness across the homes, there's strength when we bring them all together to work in a collaborative way.